this is already covered. Now about I didn't know what exactly to cover with this topic. So I thought let me have a quick look on the ocular trauma and then add on to the preventive aspects and a broad general line of management. If we talk about the ocular injuries, they are very, very common, and what the madam has mentioned about these arrow injuries, in our younger days it was a very common because of those new channel. Doordarshan was very much this thing, and then Ramayana serial, so it was very common emergency in ophthalmic practice. Then again you have the Holi, Diwalis and different type. Holi you have color chemical injuries, and Diwali you have a firecracker injuries. So ocular injuries are extremely common. Both blunt and penetrating modes can affect the anterior segments, and we don't have a exact data available, the registry of various ocular injuries, but it is being considered that around in the US almost 2.5 million eye injuries per year, and most of them this is the only probably the injuries where these male predominant, otherwise it's everywhere it is a female predominant nowadays, and ophthalmology has become a branch of all female, and now we have 30% reservation in All India Ophthalmology Society for male now, because the 70% is with them. Yeah. So I have to keep the people awake now. It is very important. We have almost 10 to 27% of all IOPD patients, other than the tertiary care centers, you will find that injury cases are there. And almost more than half ocular injuries are they belong to emergency group. If we go with the army data, I have served for 36 years, and once you are in army for more than 5 years, three things takes place in your mind. Your mind, all grey matter converts into olive green. It converts totally OG matter. You never leave it. Your uniform is changed. With uniform, your skin color becomes green. So I am still till my last breath, I will remain a army personnel in my habit, working and all activities I cannot shift. So I will keep on talking about army in between. What all you can have the various pattern of the ocular injuries. Externally you may not find anything, but internally there may be dislocation of lens, vitreous hemorrhage, intraocular foreign body. Last month I saw one case, it was so foxing for me that he came with a yellow reflex, no congestion, nothing, cornea is absolutely clear, nothing was wrong. I found at 6 o'clock around 5:30, 4 millimeter away from limbal in a white part the sclera there was a pigmentation, yellowy this brownish pigmentation. I thought could be a site of injury, but then there was nothing wrong except the yellow reflex. I said it may be a pigmentation. Shown to retina surgeon, he was also not sure whether it is a vitritis or resolving hemorrhage. And when the vitrectomy was done, it was found to be a fungal infection, and with the retained intraocular foreign body. Externally there were no injury. So you may find a very quiet eye which is having injury and severe this thing. So these are patterns which you may see that externally there is nothing wrong. Intraocular foreign body, it is lodged, and it can be in the retina, sometime it is in orbit. A rare case in 1986 I saw in Kashmir when it was the insurgency started, a kukri, it's a big knife, was in the orbit, just in front of the eye, and it is a miracle, nothing went wrong with the eye. With a big kukri went into the orbit, into the maxillary antrum, but the eye remained unaffected. And in other part you have a small needle, and it has disturbed the eye to the great extent like it can lead to the endophthalmitis or the sympathetic ophthalmitis. So the ocular injuries has such a wide diverse pattern, and in ocular we had the orbital fractures as well as sometimes there is a foreign body which is lying in the sclera. These are common in the you see this is a grenade blast injury, but in the factories also this kind of a situation with the any blast because after all in the grenade what is there? They all have the plastics and sands and all those content which the blast it comes out and goes and disturbs. And road traffic accidents if you have, those will have polytraumas. So the clinical medicine, that old dictum, treat patient in toto, is most important when you are treating any trauma case or any other injury. There may be associated injuries which we should not ignore. Corneal lacerations can be full thickness or partial thickness in the cornea, and the eye is disorganized. There is intraocular pressure may be low, and if it is a full thickness lacerations, need urgent surgical management. Iris injuries. Immediate treatment may not be required by the general practitioner, but these are the things which you can see that with the just compact concussion injury, there is no corneal tear, nothing, but the iris injuries or this cataract may develop. This is a scleral tear. Sometimes you find that the eye is absolutely red and you find a small tear is there, you repair it and conjunctiva was not explored and you find a huge big laceration under the conjunctiva. So obviously this is not at the general practice side, but in ophthalmology practice one has to do the exploration like a abdominal exploration for any appendix or any reason. The ophthalmic exploration in injury case is very much required. So whenever you have this kind of a situation, one should try to look for the scleral tears. Areas of subconjunctival hemorrhage should be seen. If there is a boggy swelling of the conjunctiva, it may be something behind it. It's a Pandora box. And pigmentation under conjunctiva, as I have already mentioned, if you see some abnormal pigmentations, one must think of something which is lodged inside. These are again a torchlight examination with any available. Nowadays we all have mobile, probably you don't need torch. And with mobile you have another thing which you can use it. Here is a zoom, the camera zoom, and you can definitely see with the zoom which you are missing there. I do it myself in so many times. I don't carry torch now. It's a very good tool to have this flashlight as well as zoom, and you can see it. You have a doubt immediately. If you have access to any ophthalmologist, you just send it on the WhatsApp and he confirms it what to be done. And I use WhatsApp very frequently for the patients getting their reports, seeing them okay, etc. And for this, if somebody is saying I am having red eye, I said send me immediately this thing. And I assess it, then I say you go and show to the nearest one, or else you have to come to me immediately or tomorrow. So all modern gadgets are good for some purpose also. Acid injuries are already covered by Dr. Tulika. She has beautifully covered various aspects, so I need not to spell it out. But my word remains there. Whenever there is a chemical injuries, whether it is a acid or alkali, frankly speaking, you may not be able to do pH and all those activities. You may not have access to all these immediately. So the answer remains, and I don't go with the special antidotes and all. Like in nuclear injuries, chemical warfare, etc. We taught the non-medical people water is the best source and use water as much as you can to clean in this situation. So that reduces whether it is a alkali or it is a chemical injuries. The toxic effects of both high pH on conjunctiva, on cornea is always there. I differ with my young friend Tulika, who's from, incidentally all big ophthalmologists, they come from the MGM Medical College. She came from MGM Medical College and I do. So steroids is a double weapon. My suggestion for that super specialty practice, yes, steroids are used. They can use even in viral keratitis. It is used. Like in case of miliary tuberculosis, in case of tubercular meningitis, we use extensive steroid. In a fulminating fungal infections, we use steroids, but under supervision. So at the level of general ophthalmologist and non-ophthalmic doctors and in the para-ophthalmic setup, I would request them to refrain them to use steroid, and rather than taking decision to send it to the some person who can observe it. Sometime I in acute in conjunctivitis I use steroid. When it is coming with the lid edema, conjunctival hemorrhage, conjunctival chemosis, then why don't give them steroids at home? I put them in a room in the center only, like in R&I used to put them there. For 4 hours to 6 hours they are there, and the steroids are put by my resident at 10 to 15 minutes interval for 3 hours or so. And I am seeing their cornea nicely and then sending back. I said, if you have some VVIP conjunctivitis, it was treated like this only. For them, yes, I was going there rather than calling them there. Every 2 hours I was sitting with them and putting steroids myself. But you cannot give, because this pyrimon has given a lot of problem of fungal corneal ulcers by simply, when earlier days in the cataract surgery, everybody had a atropine and a steroid drops. So that steroid drops for any eye reason, it used to be taken and created problem. So kindly refrain. Your steroid is good thing, but it has to be with lot of refrain, and judicious use is very, very important. Another thing, in children, it is not related with my topic per se, but if child is coming with the rubbing eyes and etc., allergies and general practice, it is a trend of giving them a steroids. We don't know which child is a steroid respondent. Steroid responders are not the dose dependent. Dose dependent may go for 6 to 8 times in a day for, say, for 4 weeks, nothing will go wrong if it is there. But if it is not a dose dependent but steroid responded, even a given steroids for 1 week can lead to a problem. And most of the cases of this juvenile glaucoma, what I have seen, all are linked with the allergic conjunctivitis, spring catarrh, and given steroids for a without any judicious this thing. I have committed a mistake. I am not talking about only that. To one person I have treated 6 months ago, I had given steroids only for 1 week. And whenever I give steroid, I always take pressure, intraocular pressure, normal, disc I have seen, everything is fine. After 1 week, his pressure was 43. So the steroids are so can create problems. So please remember that this drug is not meant for a general practice in ophthalmic setup, only in a super ophthalmic setup. Bullet injuries, it may be bullet injuries, it may be another any kind of a sharp weapon. Now bullet is not fired by the army people only. Bullet is fired, the kacha bullets and all those kache bullets you can find in any districts and anywhere, means in North India, means. Injuries, as I have mentioned, there is a lens dislocation, you can see it. Here you find that externally there is nothing wrong with the eye except just below the lower lid there is a one small laceration. But see inside what has happened to the retina there. From there the foreign body has gone, and it looks that it is not involving the eye, but it has gone and created this much problem. So you must remember that apparently there may not be a sign of a major injury, but it may lead to a major part of it. These are delayed changes on the lens cataract. Children, they are playing, school children are playing, there may be little bit fist fighting and may develop a hyphema, they may develop iris injury, they may develop cataract, and there may be even a scleral rupture. One more which is a common domestic part is a pencil injuries. This is also very common. And a last one which I have seen, not the last part of my talk about, is a quick fix injuries actually. The quick fix. It has been put here, patient has gone to a ophthalmic emergency, they have removed something, then the patient has gone to, next day he was not happy, he has gone to a cornea specialist, he or she has removed it, 4th day patient came back to me. And what I found, that everything is removed, but in the eyelashes it was lying there. Nobody has touched the eyelashes because everybody was looking into the eye only. So treating patient in toto is very, very important. Examining a patient it is missed by 3 ophthalmologists, including 1 cornea surgeon in Delhi only. So it can happen with anybody. I have also committed mistakes, but with every mistake I say how I have missed it. So this is so important in injury cases also. These are severe injuries where the same picture you may find in a road traffic accidents, multiple. These are not the road traffic one, these are terrorist bound activities. These are delayed changes of symblepharon comes when there is a conjunctiva of the outer part under the lid surface, and on the eyeball they cover, that is the symblepharon, but when the lid is attaching with this with the eye, it is a ankyloblepharon. These all are delayed changes. Foreign body. Gonioscopy obviously will not be done by you people, but sometimes ophthalmologists find that nothing wrong with the eye, but the foreign body or something is hanging in the angle. So what are the line of management? It's always stepwise management. If the patient has to be treated, repair corneal and scleral lacerations, remove blood in, this is for ophthalmologists. Aspirate and all those, and require the management. It is for the basically generally for the awareness. I put that slide is there. And any management is always better to do stepwise rather than becoming heroic, because eye is a very soft structure. If so many surgeries, a massive surgery is done in a single sitting, may disturb the eyeball and it may not recover. Now it comes to the prevention of ocular injuries. It is a very, very important, because all disasters can be, so road safety measures. I think this is the most important thing, because the road accidents, RTA is creating the maximum number of trauma is lead to the RTAs, road traffic accidents. So we must follow the road safety measures, and Nitin Gadkari has done nice for people to do the awareness, and the poor people, those who were having a less salaries, now they are benefited with that action. So they are also benefited. We must take all precautions like wearing of helmet. I think this is very, very important, and wearing of this, putting on the seat belt. Seat belt, probably you may not realize the significance of seat belt. I have always put a seat belt. I always put a helmet even if I am going for 50 yard. And 6 years, 7 years ago, I had a Maruti 800. Now I got a big car. And my wife, we had gone to meet some senior person nearby only, Max Muller line here only. He was awarded presidential award. It was a 25th January evening. We went to his house, had a sweets and coming back. On the same, this Choraya from there, you turn to this side or go to the Lodi road. I had a Maruti 800. Light, I waited for the light, it turned to the green, I shifted to the right. But I missed that small stone which was on the road divider, which was broken type. My wife, she did not put a seat belt that time. And I put on the first gear, it was on this thing, and severe jump. She had a head injury. She had a head injury. Luckily, nothing went wrong, but it was a head injury. With the Maruti 800, from a stop to this hardly 20 yard in first gear. So imagine that seat belt is so important, using it. And now I recommend, even if somebody is sitting on the rear, he must use the seat belt as in the Western countries. Helmet should have a proper helmet which does not come out. I am very fond of giving examples. A sad example of 1986, I was in Command Hospital, Calcutta, young officer doing emergency duties. And one dead body was brought there by Kolkata police. It was shock to me. He was a gynecologist in army, posted with me only, and he was in the same building. He was not using the helmet. He went to buy sweets. While coming, there is no other tram, that tram track. He had a skid. He fall there. He elderly man with cervical spondylitis. Police people found it, took him to immediately to nearest medical college. Declared dead. Then they dig out the diggy, found there was a cap, army cap. With that they realized he is an army man. So brought to the hospital. And that was a time why he had gone to market, because somebody had come to see her daughter for the marriage. It's a true incident I am telling you. And since that day, where those days helmet was not essential of this thing, I realized that how important is to put on helmet. So please, for the safety of you and your family, whether the police is seeing you or not, the helmet is so important for the road safety measures. Industrial hazards, again the preventive measures, the chemical injuries, etc. Whenever you have these, there has to be, the accidents has to be protected. Soda water bottle. In a bar, barman is opening soda bottle, his splashes had developed the eye injuries. We have seen that. Blast injuries in the boiler injuries, etc. So the industrial hazards are very, very common actually. And it all can be prevented by a preventive measures, proper precautions, and maintenance of all those industrial equipments and other things. Domestic injuries and its preventions, we have already discussed about the pencil, we have discussed about these scissors. Grandmother is cutting something and the grandchild comes there and started pushing. I have seen corneal injuries with the scissors like this only. So these all are preventable. Sports injuries, we have the battery of the sports. Shuttlecock injuries, the rupture of the eyeball. With the squash ball and shuttlecock injuries are much bigger than the football injuries. Because the football is a big football, it will hit here, it won't hit to the eye directly. But a squash ball or the shuttlecock, leather ball, it gives a massive ocular injuries. So how it can be prevented? All these can be prevented by a proper helmet and protective glasses. I think we must advocate this, that the use of specs, proper gadgets to protect eyes and helmet is most important. Radiation and biological and chemical injuries, probably today we may not think as a major issue, but after 10 years or so you may find that most of the activities will confined with the biological warfare. We all are suffering biological warfare in Asia, Africa for last 50 years. And this biological warfare is run by different governments and multinational pharma companies. All those, you have the different kind of a virus which is coming, is all are biological warfare. These are hidden issues actually. Ocular hazards of visual display and electronic devices. Sapna has nicely covered on all these things. I have written a review article which is available on PubMed. It is which has covered the all aspects of computer vision syndrome. The computer vision syndrome does not lead with only the eyes. It has a multiple involvement of the involvement other than the eye, which has a cervical spondylitis, back, there's CVT, it is there. It comes all, then psychological disorders, all those can come with the long duration activities on the computer systems when you are sitting in a monotonous environment. And iatrogenic and self-inflicted. It is there, and you have to identify and manage this. Maybe with this some kind of a motto is there, or there is a psychiatric disorder which these develop the iatrogenic injuries with the nail or something directly putting on these things. Radiation injuries like the Maya enclave and all those areas, I think it was 10 years ago, there was a leak and the radiation injuries has come. But I don't go in too much details of all those delayed radiation injuries. Those who are working, at least those who are working in the hospital setup, they should be aware of this, that radiation injuries are the chronic injuries. It can come with the X-ray exposures and MRI. I have finished 20 minutes, sir. I have 10 minutes more. Since you have seen watch, so I stop it here. Prevention. Eye armor, as I have said, what is eye armor is there. Glasses. These should be high impact resistant, lightweight, scratch proof, easily maintained, comfortable, anti-fogging, shatterless and sight seals. Laser protection filters, different types of gadgets are available. Armed forces, we didn't had a gadgets and all for each and every soldier. Now it is being provided with bulletproof jackets, with the protective glasses, in even for infantry soldiers now it is been there. And these are various delayed changes of ocular radiation injuries. Protective devices I have already covered. And we have the World Trauma Congress in Delhi in the aegis of Ocular Trauma Society of India. I am one of the executive and additional secretary, organizing secretary for this conference. So it is open for all those who are interested to learn more about ocular trauma and its prevention. Thank you very much.